Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about Raynaud's syndrome or Raynaud's disease. Now, Raynaud's disease is a disease of vasospasm, where basically the blood vessels spasm and they close off, causing discoloration and a lot of times numbness and significant pain to the tips of the fingers or the tips of the toes in cold environment or with significant stress. Most common being the cold environment. Some individuals with the Raynaud syndrome say they have to always be in gloves even if they're getting stuff out of their freezer. So they reach into their freezer and they get the symptoms of Raynaud's disease. And the fingers will often be numb, tingling, and not just feel cold, but look cold. So they turn white, blue, or black appearance where they're really, really dark, not a true black, but they look black in that point. And you can get prickly feelings or even significant stinging pain while it's happening or while they start to warm up. So it's usually a process. It's usually a stepwise process. So initially it will start to turn white, and then it will turn blue and feel really cold and numb. And like I said, it can get to the point where it's almost so dark can cause pretty significant pain. Other areas it can affect the nose, lips, ears, and even the nipples, but most common are the fingers and the toes. A lot of people will say, okay, if I'm starting to get this problem where I notice anytime I'm in the cold that my fingers really, really hurt, my toes really, really hurt, when should I go see the doctor? You can see them at any time. The advantage of going and seeing a doctor is they can evaluate this and you can talk about symptoms and say, okay, what can I do to treat it? And we can give you some options as far as treating it. So it is typically a genetic problem. It's usually inherited, more common in women than in men. Usually present sometime between 15 and 30, although it can present at any time. That's the most common, is you'll start to notice it sometimes between the age of 15 and 30 years old. It's more common, of course, in colder environments. That may not be the case because it's just more common in colder environments, but you're getting the symptoms. If you're always in warm environments, you're not going to notice the Raynaud syndrome because you're not going to be experiencing cold situations where it can happen. Complications, the biggest complication, of course, is if you get severe Raynaud's, you can actually have it block the arteries and you can get almost like clotting in that area. So how do you prevent it? Of course, the most common is to say, okay, just keep it warm, keep the areas warm. Warming up the car, wearing gloves and socks and warm shoes, taking precautions even indoors, like wearing socks, can actually decrease the chance of there being a problem. Treatment-wise, there are medications that can be used for this that are used to alleviate the blood flow. Calcium channel blockers are a type of medication that can be used for this. Vasodilators, basically things that cause the blood vessels to expand, can actually help with this. But typically what we end up doing in our case, we say, okay, how can we allow you to function normal and treat this? The most common thing that we're now using for this is a vitamin, a simple vitamin, niacin. With niacin, it seems to improve the blood flow, which decreases the symptoms of Raynaud syndrome. That doesn't mean you still don't need to be careful and try to keep things warm, but you're less likely to have the symptoms because the niacin improves the blood flow to the extremities, so to the digits of the hands and the feet. So if you have a situation where anytime there's cold, you get severe pain and discoloration to your tips of your fingers, tips of your toes, and it seems to get worse as you're going throughout the winter, there are things that can be done and you should be evaluated to see if you have Raynaud syndrome. Although there are some tests that can be run, most of the time we don't have to do any tests. We just do it based on symptoms. And if we can eliminate the symptoms, it really doesn't matter if you have a diagnosis of Raynaud's or not. It's more important that we just find a way to treat and the symptoms and so forth. This is Dr. Brandt Gibson. This is your Podiatry Tips, day 49. So have a great rest of your night.